Hi, I'm Amy, and I'm a stage 3 breast cancer survivor. This video is about chemotherapy treatments for breast cancer. We'll cover what is chemotherapy, what should I expect, and how can I prepare. First, what is chemotherapy? It's the use of drugs to destroy fast-growing cancer cells. Cancer cells grow faster than healthy cells, so chemotherapy targets those fast-growing cells. However, because chemo attacks fast-growing cells, it can also affect healthy cells that are fast-growing. Some fast-growing examples are skin, hair, and intestines. I think of chemo like treating a garden full of flowers. I can easily pull the weeds that I see, but I also need to treat the entire garden with an herbicide for the weeds that I can't see. Your medical oncologist will determine which regimen to prescribe based on your age, the stage and type of cancer, your genetic profile, and any diagnosed health problems. I just want to clarify that hormone therapy is not the same thing as chemotherapy. Chemotherapy kills fast-growing cells, while hormone therapy blocks the production of estrogen and progesterone in your body. You may hear some scary nicknames for the regimens. I ignored those. The medical oncologist and the pharmacist are the experts. They want to prescribe what's best for the patient. Next, what should I expect during treatments? Treatments for breast cancer are usually given in cycles. They can vary from once a week to once every 3 weeks. Each cycle is followed by a period of recovery. Before each cycle, you may be instructed to take a steroid to help control nausea. I took them as prescribed, and they worked every single time. At the start of each treatment day, you will have your blood tested to confirm blood cell and platelet counts and your kidney and liver functions. Once you're in the chemo chair, the chemo room pharmacist will meet with you just prior to the nurse giving you your first chemo infusion. The purpose is to review side effects and any precautions to take after you complete each cycle. Chemo can be delivered intravenously by slow drip, through a port inserted in your chest, through a catheter in your chest or arm, by injection, or as a pill. You may receive multiple drugs during each cycle, but the nurse will administer each drug separately. I was usually at the hospital for 6 to 8 hours, starting with the morning blood test through the last treatment of the day. Lastly, how can I prepare for chemotherapy? You'll want to improve your overall health through diet, exercise, and rest. I can't overemphasize the importance of a healthy diet because as you move through your chemo cycles, it becomes difficult to continue healthy eating habits. So it's best to start out with a super healthy diet. You can start getting more exercise as soon as you can before treatments, since it becomes more difficult after you start. Rest is probably the hardest thing, but we set up an extra sleeping location for my peace of mind, and it made a big difference for me. Ask your doctor what to expect and plan for side effects prior to beginning treatment. For example, get a wig, scarf, or other head covering for hair loss. Get over-the-counter treatments for mouth sores and constipation. If your doctor prescribes anti-nausea meds, get them before your first treatment. Also, Try to arrange for extra help at home and work before you start. Chemo side effects will increase over time, so you will need help after repeated cycles. You also may have to stay away from others during certain phases of your treatments, so you will need help, and you may need to be away from work. Chemotherapy can be pretty tough, but sometimes it's the only way to ensure that we get the weeds out of our beautiful flower garden. Thank you for watching. Please take a moment to check out our other videos on breast cancer, and if you find this information useful, then please like and subscribe. This is Amy at Pink Streaks, reminding you that an informed patient is a good patient.